When is it too late to start hormone replacement therapy? That's a question that's getting attention these days and should be asked more frequently. We're finally talking about hormones again for postmenopausal women. Well, when I say we, I mean general medicine. I've been talking about it for years, but the general consensus with the FDA black box warning amongst doctors that just, followed the algorithms and didn't have the energy to question was that hormone replacement therapy was dangerous. And so certainly don't give it to any woman that's past the window, which was kind of arbitrarily set at 10 years past menopause. We used to recommend hormone replacement therapy, and the purpose of the Women's Health Initiative was to prove that it helps prevent heart disease. It had nothing to do with safety. It was heart disease risk. And then the problem with that, as we've discussed in multiple different platforms, was the age of the women that they brought into that study varied from 50 to 70. The average age was well past menopause of women entering into this study. And we know that heart disease risk increases over time. So how can you prevent heart disease if you already have it? And so a lot of those women that entered the study to decide if they could prevent heart disease probably already had it. Anyway, let's get back to the question, when is it too late? So the problem is the Women's Health Initiative data that caused all doctors to stop hormone replacement therapy came out at the end of 2002. It was 23 and a half years ago. There's a lot of women who missed hormones because their doctors were relying on that data and didn't offer it. In my practice now, I have so many women coming in their late 50s, early 60s, mid 60s, late 60s, seeking to improve their health span and their brain function. And I asked them, did anyone ever talk to you about hormone replacement therapy when you were going through menopause? And they say, no, was never even brought up. Well, of course, because if the doctor believed that it was going to cause harm, they weren't going to bring up something that caused harm. Well, now we know it doesn't for the rightly chosen woman. So what do we do with those women that are now in that window? They're in their mid 60s and they're struggling. Here's what you need to know. The studies do show that the earlier you start hormone replacement therapy, the greater the benefits. Well, that makes sense because you're not living for years in a hormone deficient state. Does that mean that there's no benefit for the women who start later? Absolutely not. It means that there's not as much benefit, but it doesn't mean there's no benefit. So this is why it deserves a conversation with a doctor who's willing to listen to you and knows how to investigate all the health issues going on with you. So why don't we just start everybody on hormone replacement therapy then? Well, some people might, but again, I think it deserves a conversation. We shouldn't do blanket yes and blanket no for everybody. Your body doesn't work that way. You deserve individualized attention and personalized recommendations. So the theoretic risk is that we know that estradiol increases blood vessel plasticity. It helps to maintain the elasticity, the flexibleness of the arteries. That's a good thing. But the theoretical risk is if somebody already has heart disease and they have plaque formation, and now all of a sudden you increase the elasticity of the vessels, could that dislodge the plaque and lead to a heart attack or stroke? That's why people are talking about don't start hormones after a certain age. Well, that's the biggest reason. What if we can evaluate your heart disease risk before we put you on hormones? I think that's important. So that's what we do. And certainly it's way more than just a total cholesterol or even a lipid panel looking at HDL and LDL. That is way bad predictor of whether you're at risk for heart disease. That's a different topic. I'm happy to cover that later. For now, just know that you should have an evaluation. You should get individualized attention, and you should be able to have the conversation about risks and benefits for you. So the other reason that women weren't offered hormones past a certain window was that they thought, it increases your breast cancer risk. Well, now we've just proven that too. So I don't If you use the right hormones and you check the balance and you make sure you're metabolizing them in a healthy pathway, I'm going to argue that hormones don't cause cancer. If you have cancer, they may make it grow faster, but they don't cause it. Toxins cause cancer. Immune system dysfunction causes cancer. Hormones do not cause immune system dysfunction, bioidentical hormones. So we know now that hormones don't cause cancer. So I don't think the breast cancer equation should be part of it. But that's the other reason why women weren't offered, because there was this misconception, and it was one of the recommendations that ACOG, which is American College of OBGYNs, ACOG used to recommend was, sure, if a woman's really, really struggling, you can put her on hormone replacement therapy, but make sure you cancel her of the risks and don't do it longer than 5 years, because at the 5-year mark, they have an increased risk of breast cancer. Okay, we've proven that that's not true. So don't include the breast cancer risk in your calculations of whether or not you should take hormone replacement therapy and the age at which you should start it. We only really want to look at the cardiovascular risk, and that's theoretical. But still, guess what? The number one killer of women over 50 is heart disease. And you know what the first symptom of heart disease is? A heart attack. There's no symptoms. So that's why, as a hormone locksmith, I want to optimize your hormones, but we also want to make sure everything else in your body is working well. I don't want to give you beautiful hormones and not evaluate your cardiovascular disease risk, have your hormones optimized, and then a month later you drop dead from a heart attack. We got to look at the whole picture, whole person health. And lipid panel's not enough, so we do a very thorough evaluation. And if we're looking at a woman in her mid-60s that never got offered hormone replacement therapy because the doctors were afraid based on the data that they had available to them at the time, and let me rephrase that, it wasn't the data. The data's always been there. It was the recommendations that they followed, the algorithms, the committee opinions. The data's been out for decades. And a lot of doctors questioned the WHI results. Many doctors questioned, but they were pushed under the rug and called quacks. Well, guess what? They were right. I'm Dr. Yvonne Karney. I'm the hormone locksmith. If you're in your late 50s, early 60s, mid 60s, and you wonder if hormone replacement therapy is right for you, have that conversation with your doctor. And if you know a woman that needs to hear this, please pass it on. Have a great day.